You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, a new treatment option for people with chronic headaches, migraines, or TMJ problems. With us, we have somebody that focuses their practice on helping people reverse these problems. With us, we have an expert on the topic, Dr. Abeles. Dr. Abeles, welcome to the program.
Randy, good to be here.
Now, you're all over the news talking about this. I went to your website, lots of news interviews. For people that don't know your practice, I guess this is your focus, migraine headaches, TMJ problems. Who's a typical patient that comes in?
A typical patient, probably married, housewife, 30s, few kids. Certainly, we're all over the spectrum. That's not just limited to somebody that's female in that age range, but their life isn't working for them very well anymore. They're living with chronic pain. They've been to a lot of other doctors. Nobody's been able to help them. They may be on a bunch of different medications. They're tired of taking the different medication. They're just kind of worn out. Sometimes within just a few minutes of sitting down in my office, Randy, they're going to burst into tears. And it's a pretty emotional process. I don't think that would happen if these people were happy. Some of these gals are depressed, and I think any of us would be if we were dealing with chronic pain. If you had migraines every day, you've been to a lot of doctors and nobody been able to help you.
But you help people.
We do help people.
I mean, in the green room, you said every single day. I said every week. You said every day.
We do.
You see reversals of these symptoms.
It's part of our practice, yes.
Is that right?
Yeah. Every single week, we have people that are telling us that they're happy because they're no longer on medication. And it's a great feeling for them.
Is this a big problem, by the way? a lot of people have migraines.
Yes, it is. Throughout the entire United States, there's 45 million people. In Atlanta, we could probably fill up the new Braves Stadium that's being built right now with people that have chronic headaches, chronic migraines, neck pain, pain behind their eyes, TMJ pain.
Now, what do medical doctors have to say this? In the green room, you said that medical doctors are starting and they're sending you patients.
Yes, they are. The ones where we get referrals are typically the ENTs, some of the neurologists. These patients have been on a lot of medications, and the medications just aren't working for them, Randy. We get referrals from dentists, too. Same thing, where they've done their best. Maybe they made a bite guard or a night guard for somebody, put them on some muscle relaxants like Flexeril or something comparable, but the patient's just not getting better, and they wind up finding their way to our practice and being referred to us. So I can think of a patient that one of the doctors had referred to us. She'd been on all the different medications. Things weren't working for her. We found a position for her bite and her jaw where things were working better, where these muscles were more relaxed, and we were able to get her off the medication.
And for people just tuning in, we're talking about getting rid of headaches, migraines, and TMJ problems without medications.
Yes.
So the whole premise here is, which I don't understand, the way the teeth are coming together are causing headaches. How? Give me a basic, I guess, explanation of this.
Let me bubble this on down for you and make it as simple as I can. The only joint in our body that is positioned by a bunch of teeth is the TMJ, the temporomandibular joint. If the lower jaw is not in the right position, the muscles that have to try to brace it and support it and stabilize it in that position, they can wear out. And if they do, they can go into spasm, they can go into stress and fatigue, and they can drive a lot of this pain. So if we can find the proper alignment for the jaw and the bite, where these muscles are happy, I know that's kind of a...
What do you mean muscles are happy? What does that mean?
That's kind of a non-scientific term, but I think everybody understands what it means. If muscles are happy and they're functioning better and they're behaving properly and they're not causing pain, we can make these symptoms go away, Randy. If the muscles are worn out or stressed, trying to hold the jaw and the jaw joints in a position where they're not supposed to be, they're going to drive a lot of this pain. So if we can find a position for the bite and the jaw joints where these muscles are more relaxed, we can reduce or completely eliminate these pain symptoms.
So you've had patients where they come in, their teeth weren't coming together properly. And you're saying, what, there's nerves right? I'm pointing right here because I looked at your website.
There's nerves there. There's a trigeminal nerve.
And they go to your head?
Yes.
Okay. So all you do is you get the teeth coming together properly.
Yes.
And you've had patients that their headaches are gone.
That is absolutely
correct.
What
if somebody's been like 10-year migraine headache sufferers?
Sometimes a little tougher if it's been a while, but still completely doable. I've had a patient that went 4.5 years, 13 different physicians. They're great doctors. I have nothing but the highest regard for all of my brethren in the medical field. So not saying anything adverse about them, but everything had been tried to no avail whatsoever. The patient said she was 95% better within 30 days when we saw her back from her initial therapy. What did that mean to her? It meant that her headaches, her eye pain, her neck ache, her crunching in her jaw was gone. Prior to our therapy, the one way she was trying to cope with this, she'd wind up going to bed. Great lady. So she was not willing to take no for an answer. Everybody had tried to help her sincerely, but they still did it to no avail. A person like this winds up giving up little pieces of their life, little by little. They've been told by people they just need to deal with it. They just need to live with it. This is as good as it's going to get.
Live with what?
Live with the pain, live with the dysfunction, and that it just is not going to go away. They wind up giving up little bits of their life, Randy. They can't go dancing anymore. They can't play sports that they want to anymore. They can't show up for their kids the way they want to. They can't eat food that they enjoy, something, the most basic thing that we all take for granted all day long. Just enjoying food is a pleasurable process. And these people are limiting their diet severely because they know if they're eating the wrong foods, they're going to pay for it and be in pain for hours or sometimes even for days.
Because I know a couple of people that get migraines, a week out of the month, or chronic headaches. They're edgy, like moody.
Yeah.
So obviously,
or depressed.
So it makes sense if you take that away, they're going to be in a better mood.
Yeah.
What are the symptoms? Because we talked over there. You said, I want to say you said slam dunk, like it's an easy one. But what are the obvious symptoms? Like that your teeth might have something to do with a headache.
Your jaw clicks or pops. If your bite's off. So what does that mean? That means that when you bite together, things just don't feel like they fit together properly. Maybe you hit and the jaw slides a little bit in some position. Maybe you're missing some teeth and the bite is slightly shifted or collapsed. Maybe you've had a tremendous amount of dental work done that has altered the bite. Maybe somebody had braces done. Nothing wrong with orthodontics, but sometimes, depending on how it's all ended up, the bite just doesn't feel quite right.
And they have migraines.
And if they have pain, it's a warning sign.
Okay.
It could be coming from their teeth. It could be coming from the bite alignment, yes. So let me go back to the popping here for a minute. If we click or pop in our jaw, it's a perfect sign that says the jaw and the jaw joint is not in the right position.
But how is it causing a headache?
The way it causes a headache is this. So again, it's just a warning sign that doesn't cause a headache, doesn't cause any pain. But if we do click or pop, it means the jaw is not in the right position. If the jaw is not in the right position, then the muscles that have to support and stabilize and brace the jaw, that's what wears out. That's what causes 90 to 95% of the pain, including the headaches and the migraines. So these muscles are fatigued, they're tired. It's kind of like having sore legs the next day.
After a workout, okay.
They're worn out from working out too much. So the muscles then give a noxious signal to our nerves, most notably the trigeminal nerve. And the trigeminal nerve drives a lot of these pain in our headaches and our migraines.
The other one, you say if you wake up in the morning with a sore jaw.
Yep.
And you have chronic headaches or migraine headaches, might have something to do with it.
That could have something to do with it. Even forget before you wake up, even when you're sleeping. If your partner or somebody tells you snore, that again is a warning sign that says these headaches might be coming from your jaw and your jaw joint. The reason is if we snore, our lower jaw is a little bit too far back. And if it is, the tongue track's right between there. Somebody wakes up and their jaw is sore, their muscles have been working most of the night. If they are...
That's why it's sore.
That's why it's sore. Particularly the masseter muscle. Our brain can even send a signal to our muscles while we're sleeping if our airway isn't open enough and it's trying to get the jaw moving to get the airway open. And these muscles are fatigued. If they're worn out, we wind up with pain. Even what's called morning headaches is a specific, particular type of headache where somebody rises in the morning and they already have their headache and it's got an onset for most of the day or the entire day. And that can be caused by low oxygen saturation in our blood because we weren't breathing right at night, the jaw was in the wrong position, the airway was closed off. So what we do is make this custom bite splint orthotic, call it whatever we want, this little device that allows somebody to keep their jaw and their joints in the proper position. If we achieve that properly, then they're going to wake up, they'll be comfortable, they're not going to have headaches, and the muscles aren't sore. I've had many patients where this was their symptom, where they wake up in the morning, the jaw is sore, the muscles are hurting, we found the proper position for the jaw with the device, and their pain went away. Headaches went away.
Interesting. Now, you tell me that some people, really, like all day long, they have headaches, migraines.
Yes. I had a lady that had migraines for 24 hours a day for 3 months. I cannot possibly imagine what that would have been like to go through something like that. She'd been to numerous physicians, tried different medications to no avail.
Like, how does a person like this find you normally?
They may have found this on the internet. That's pretty typical.
Okay.
But by the time she came into my office, she was depressed. Now we have an overlay of depression. I think that would happen to any of us. It would happen to you, it would happen to me. If we lived with chronic pain 24 hours a day for months, I think any of us would be depressed. The most notable thing I remember about this meeting with this lady was this. We sat down, and within about 5 minutes, she burst into tears, not from unhappiness, but she was so excited that there might be a possibility that there could be relief for this pain. As we delved into it, we went through a detailed diagnostic physiologic workup. Most of what we do these days is on a computer, about 75% of it. We track the jaw in 3D to 1/10 of a millimeter of accuracy. We have EMG leads that are placed on the muscles of the head and neck to start to see how they function and how they behave. We made her a custom bite appliance. She is now 2 years pain-free, no headaches, no migraines, and said it was truly a life-changing experience.
How soon could somebody like this get better? Like a month into it? 2 weeks into it?
Good question. It can happen anywhere from literally within a few days. Some people take a few weeks. Some people take even a few months. So talking about sometimes does it happen right away? Sometimes does it take some more time? We had a patient that was quite skeptical when he first came in. He was worried about the cost. He'd been to a lot of other doctors. He had, since age 17, been told he had TMJ problems and headaches, been taking a lot of pills, and been living with it for the next 16 years. So now he's on my doorstep, and we feel that we can help him. A week, 2 weeks, 3 weeks, a month, no real significant improvement. We're about 2 months in, and he was ready to quit. And I urged him, I said, just hang with it a little bit longer. And these are his words. He woke up one day after one of our physical therapy appointments, and he said, Fred, I feel like I did when I was 16 years old. I forgot what it was like to not have pain. And that was when he turned the corner. Now he says he thanks God that he found us. I'm not trying to overstate it, but the point is, we have some people that feel great after a few days. We have some people during the diagnostic workup, when we're using some of our instrumentation, part of it is a particular type of TENS that relaxes these muscles, not the type of TENS that a physical therapist would use, but some of them say, wow, I can tell this is working almost immediately. But typically, muscles respond anywhere in about a 4 to 6 week period of time, on average. All tissues in our body have a certain amount of time they take to heal. We blow out a tendon or a ligament, it could take a year. We injure bone, it could take 6 months to 9 months. We cut our skin, maybe it heals in a few weeks if it's not a bad laceration. The sweet spot for muscles, about 4 to 6 weeks.
Okay, now, for people just tuning in, we're here with Dr. Abeles. He is the author of Breakaway, a new method for treating chronic headaches, migraine headaches, and all without medication. Now, so you have that in the book, and I know you're a big fan of what medical doctors are doing, and you work with medical doctors.
Indeed.
So you really, people that have been on medications for their pain, for migraines, because they work, right? I mean, some people have to do it.
Yes, of course they do.
But you have people that don't take medications now. How often? Like once a month that happens?
How often do I see somebody?
Getting off their meds.
Every week, possibly every day in our practice.
Is that right?
Yes, yes. It's a big part of what we do. I'm not against medication. Medication's great. Somebody can have Botox injections in their muscles. It will temporarily freeze the muscles. It does work. Medicines work. But do you want to keep taking those all your life, or would you like to find a solution where you don't have to take medication and still get rid of the pain?
Our show, The Wellness Hour, has been on the air now for 16 years on TV, on broadcast, and cable TV, and satellite across the country. And 16 years ago, I would have dentists that were coming on the show talking about this, and they were considered quacks, or they were considered crazy. And medical doctors were frowning on this. And now we have medical doctors that come on my program, mainstream guys
Now it's mainstream.
that are saying, yeah, it does work.
Yeah, yeah. I think anybody...
But people are still skeptical. Is that your challenge as a doctor, to get the public to know, hey, if you have migraines, have it at least looked at?
The founder of the Institute is a fellow, a dear friend and a mentor of mine. His name is William Dickerson. That guy's had more arrows in his back than anybody I can count. When you're first and you're out there with a breakthrough technology, there's going to be skeptics. There's going to be people that want to detract from it. Now it's mainstream. Now it's accepted.
The results are there.
There's so much medical research that proves this is physiologically correct.
But if somebody were, to go through your files, I mean, you have story after story after story, like hundreds of people
We do.
that had migraines, now they don't have migraines.
Yes.
You have patients that have, I mean, we're talking about not just chronic headaches, but migraines.
Mm-hmm.
But what about cluster headaches and things like that? I've done a little bit of research knowing you're coming over here. So
No worries.
there's all types of names for headaches.
Cluster headaches, migraines, whatever, tension headaches, whatever we want to call it. Physiology is physiology, muscle is muscle, headache is headache. If we have chronic pain and it's being driven by the muscles and the nerves, if we can find the underlying tissue that's causing that pain, address it and treat it properly, we can make the pain go away.
All right, and you see that. And I know, look, we have to, people need to know it's a real interview, right? I'm not trying to endorse you here. But the fact of the matter is, not everybody gets 100% results, but you have reversals.
Yes.
And you see transformations in people's lives.
Yes.
Every single day.
Truly.
Is that right?
Yes, it is.
And
I'm living, eating, and breathing this. This is my passion. This is what we do. My entire team, we feel that, at least in Atlanta, we're doing something very, very special for those people that understand and select us to be able to care for them.
now this is not a recognized dental specialty treating migraines, but this is what you have focused your practice on.
Yes.
Is that correct?
That is correct. This is all we really want to do. I'll tell you what, for many years, I started out as a general dentist, don't want to bore you to tears, moved into reconstruction and cosmetics many years ago. That's all wonderful work, but there's nothing more rewarding, more personally fulfilling than being able to change somebody's life and take away their pain. This is all we want to do.
All right, now, in fact, because we talked, you left dentistry because you were bored, because you were trained as a classical jazz pianist, right? Is that
True.
right?
Yep.
As a pianist.
Didn't know we were going to talk about this.
And but then they found out, I guess, you were a dentist, and then you got back into dentistry. You found out about migraine treatment, and now you're excited about dentistry again.
Yeah, I love it.
But what do you say to those people, the critics that may say, yeah, but a dentist shouldn't be handling head and neck pain or headaches, migraine headaches?
Fair enough. That's their opinion. However, if the pain is coming from the bite, if the pain is coming from a misalignment of the jaw, that's our world. That's our expertise. Nobody else can do this but a dentist.
Now, when you first obviously got into this, right, you had a first couple of patients, like way back whenever, right?
Sure.
Were you kind of like saying, let's see if this works?
Once upon a time, yeah.
Were you surprised initially, like, wow, this is, were you ever surprised?
Well, if we really go back to my very humble beginnings, before I got my training at LVI, I was doing what the average general dentist would do, and I was just making some sort of a night guard or a bite guard, giving a little bit of medication, some muscle relaxants and anti-inflammatories. We had a little bit of success, but we had a lot of failures. And I said, is there a better way? That's part of what brought me out to the Las Vegas Institute in the first place. They were having these amazing results with treating chronic pain that nobody else was having, and that's where I got my training. And I'm really standing on brighter minds than me that did the research and development. I haven't invented any of this, Randy. I've just been taught the specific physiology and approach and protocol to be able to help these people. So it's not that I'm great in anything I'm doing, it's just that I love doing this and the science works.
So is your goal in Atlanta to wipe out migraine headaches? Is that your secret mission?
That would be a worthy goal in Atlanta, but my goal is really to help any individual that will entrust us with their health that has chronic pain and no one's been able to help them, if they're going to entrust us to care for them, yeah, we'd like to wipe out their migraines, we'd like to wipe out their headaches, their neck pain, their TMJ problems, whatever it may be. That's what we do. There's tens of thousands of people probably just within Atlanta that I feel can be helped with this type of therapy.
Okay, so if you have sore jaw, you've been told by your dentist that you're a grinder, you have popping and clicking, right? You have migraine headaches, you've tried medication, you've done everything. What's the consultation like? Okay, so they go in, they think they've tried everything, as you say, right? Mm-hmm. They end up with you as a last resort sometimes. Medical doctor, ENT sends them to you. It's worth a try, right?
Of course it is. They have nothing to lose but their pain.
Okay.
So what's the consultation like? They come in, I sit down with the patient in person, we sit and talk. First, they're going to tell me their story. As I said many times, not always, but people will be in tears within a few minutes because they've been living with pain so long. But point being, they're going to share what's going on and what's not working in their life at this point. After that, I'll share a little information that I feel is relevant, try to give them a little bit of the cause and effect. You want to learn more about it? I'm not pimping out my book, but you could read about it. So I ask some questions that are directed to get a little history in terms of what they've been experiencing. I'm going to ask some questions in specific about how their jaw functions, where their pain is, what the duration is, what they've done to try to remedy it to this point, what previous treatment have they had. At a certain point, we're going to go over into the treatment chair. We'll sit down and I take a look at them. It's not a full examination, to be sure, and I don't want to be boastful, but within about 5 minutes of looking at somebody, with no diagnostics, I can get some sort of a beginning sense whether we can be a benefit to them or not.
So you hook people up to some computerized diagnostics that give you an idea how their teeth come together?
Yes.
Is that correct?
True.
And do you ever, in your mind, like when you think this is going to be a good one, right? You get excited about that?
Yes. Some of them are slam dunk. Sometimes we will see things that are so clear that it's just screaming out that this is what the underlying problem was.
What do you tell them?
And do I get excited? Yes. They get excited actually when they see some of the instrumentation. Obviously, we can't show it to you on the air right now, but anybody, any layman can tell the difference between an EMG of a muscle that's really, really agitated and one that's smooth and copacetic. So they can see the difference between where their original position is and the position that we can show them. I can think of a patient, even without the instrumentation, had horrible vertigo and dizziness problems. He'd been to all the different physicians, gone through vestibular therapy and tried all these different medications. Nothing had helped. The biggest thing that he was missing in his life was sports. Of course, he had some problems with driving and some other things. During the consultation, I just took some cotton rolls, Randy, and I put them in his mouth and moved his jaw to what I felt would be a better position, and I checked his balance, and it was substantially improved just from that. He was in immediately, so we didn't even need the computerized equipment to be able to see the difference. Long story short, if we flash to now, his balance problems are gone. He's playing golf again, which is his favorite sport. And I love his testimony on my website. I don't know if I can say this or not, but I'm saying, he said, before Dr. Abeles, I was in hell. Now I'm in heaven. I have another patient. We just saw her the beginning of this week, and she was in for a checkup, and I haven't seen her since 2011, so it's been about 4 years. Headaches, migraines, she's doing great. She's married. And we saw her, and this was, I thought, a terrific statement. She said, my husband and I both decided if our house was burning, we said the first thing that we're going to save is my orthotic. That's her bite device. True story.
Is that right? Now you say some people come to you, I mean, they have a tough time, they have so much jaw pain, they have trouble eating food.
Yes. You know, it's one of those things, those little pleasures in life, and they wind up giving up eating certain types of foods. But it reminds me of one patient of ours, Elizabeth, who came in a number of months ago. She had to puree all of her food. She couldn't chew, she couldn't speak, she couldn't swallow properly, she couldn't walk properly. She literally came in like an invalid. She had lost over 15 pounds. She could no longer work. I am not exaggerating this at all. And she said that we have given her her life back, and it's the best gift that anybody ever could have been given. She's gained her weight back. She's back at work. So this is real. So again, we found this proper position for her jaw and her bite, where her muscles were functioning properly. She had this horrendous pain on the left side of her head. It is gone. She's feeling better.
She just made a splint for her mouth?
We made a splint for her. Yes, we did more than that. Again, there's physical therapy. We have things we have the patients do at home.
So all done in your office? You have at-home care?
We even have some things, we'll send them home with some home care devices, yes. But the main crux is the splint. That's what's going to align the jaw, align the bite, and get rid of this pain, yes. So her jaw pain's gone, her headaches are gone, she doesn't have to puree food anymore, her weight's back, and she can start to enjoy her life again. She's participating in life.
Now, a lot of these people, and this is a big discussion because I've read your book, right? That they were misdiagnosed by somebody else, right? They didn't look at this area as being something that would have anything to do with it. Did they ever, when it's all done and they're feeling good and their migraines are gone, do they ever go, I can't believe that everybody missed it. I can't believe it was this simple. Is that ever a discussion?
Yeah, and sometimes they actually get angry. They really are, that they've been to so many other people for so many years and that nobody picked this up. So sometimes they're angry, but yeah, they're frustrated. I feel their frustration.
And we're out of time. But we should mention, I mean, you are one of the most sought after people here in the U.S. when it comes to TMJ and migraine relief. Is that right?
Fair enough.
And you also, you know what I like about you is you came on the program and and you made it clear. You go, I don't want to badmouth medical doctors. I don't want to say anything negative about dentistry. And I guess your main message, I don't want to put words in your mouth, was that if you think you've tried everything and you have migraines and these other problems, at least give it a shot. Let us try. So final message, somebody watching this, right? And I guess they're in pain, they're miserable. What do you say to them?
Final message, if you have tried other remedies for your chronic pain, for your headaches, for your migraines, for your temporomandibular joint dysfunction, and you're still not feeling better, please, please don't accept that as a life sentence. Seek some help, keep going, keep trying till you find somebody that can help you. If you wind up landing on our doorstep, wonderful. If not, go somewhere. Do not accept this chronic pain as a life sentence, because I truly believe from the bottom of my heart, these people can be helped.
All right, good. I want to thank you for coming on the show. Great stuff.
Thanks for having me.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez.